Hello, my name is Michael Vosberg, and for my Apex presentation, the study I chose to cover was depression, anxiety, and stress in collegiate aviators. I'll be covering the poster from left to right, starting with the abstract. The purpose of this study was to find out if students attending college for their aviation training were more susceptible to depression, stress, and anxiety than other flight students who trained outside of college. A common concern these days for college students is their mental health. These students now must learn to be independent and take on new responsibilities. Not all students can cope with this new experience and find themselves slipping towards depression, anxiety, and/or stress. Once these mental illnesses set in, students can see that their grades might decline and students might find themselves struggling with substance abuse. The methodology that this study used was a self-reporting system called DAS-21. The survey used a 4-point scale where the answers would range from never to almost always. The scores would be totaled for depression, anxiety, and stress categories. Then those scores are compared to the DAS-21 score range. This range is shown in the middle of the poster. All three categories have different ranges, so scores in one category cannot be compared to another category. Self-reporting has been known to receive some over-exaggerated or dishonest responses. This is one of the best methods to diagnose these mental illnesses. For the case of this study, diagnosis is not the intention. Rather, it is testing if the participants feel that these issues are affecting their daily lives. Some discussion the authors had about this study was that most of the students reported the same scores as one another. As shown below in the DAS-21 score mean, most any of the scores differed was by 0.76 for any anxiety. A potential answer for this could be that all participants are students. Even though the non-collegiate flight students are not attending college, they are still dealing with their own responsibilities and obligations. Another potential reason for the similar results could be that pilots often have a pilot personality, so to say. Pilots have been found to have more of a hardened personality and are more resilient to developing depression, anxiety, and stress. The results of the study showed that students all scored similarly on the DAS-21 survey. The mean scores reported are highlighted in yellow on the DAS-21 score range. When breaking down the students' scores by class level, the scores remain similar. The highest scores received were in the stress category, but these scores still fell under the normal range for this category. Stress was the only category that the collegiate flight students outscored the non-collegiate flight students. As for the conclusions on this study, while the scores were similar, there were some interesting results. Non-collegiate flight students reported higher scores in depression and anxiety, the largest difference being displayed in the anxiety category. The study's hypothesis was that collegiate students would score higher, and it turned out to be the opposite for 2 out of the 3 categories. While the study's main purpose was to find if collegiate flight students are more susceptible to depression, stress, and anxiety than non-collegiate flight students, it was also a chance to teach students the importance of mental health awareness. Mental illnesses in students has been on the rise, and it is important for students to be able to identify and cope with them.